Hi everyone, my name is Emily. I'm going to be doing a presentation today on ACT, which is Acceptance Commitment Therapy. So let's get started. So in this presentation, we are going on a journey, so strap in. I'm going to guide you all through what ACT is, the 6 main pillars of the modality, and what the literature is saying about the modality. Then we're going to discuss the cultural considerations surrounding this modality, and we'll finish off by going through a couple of ACT interventions so you can get an idea of how it's used in practice. Ready? Let's go. Well, ACT is pronounced ACT, not ACT. ACT stands for Acceptance and Commitment Therapy. It is part of the third wave of behavior therapies. ACT was originated by Stephen C. Hayes in the 1980s, and then it was developed further by Kelly Wilson and Kirk Strosahl. Before that, in the 1970s, Aaron Beck used comprehensive distancing to step back and notice thoughts, which is a lot of what ACT is based on. But in the 70s, Beck used this as part of cognitive therapy. So notice the thoughts in order to change them. So unlike ACT, comprehensive distancing was used in order to correct maladaptive thoughts. In the 1980s, Stephen C. Hayes had a 3-year-long struggle with panic disorder, and he vowed never to let his panic control him. And that was kind of the basis for the groundwork for ACT. The primary skills that are learned through using ACT is to learn to notice emotions, thoughts, and feelings, and build psychological flexibility to be able to notice and acknowledge those thoughts without the thoughts taking control of your behavior and action. What is psychological flexibility, you may ask? Well, it is the ability to stay grounded in the present, even when experiencing difficult thoughts and feelings, and being able to accept those thoughts and feelings while still making decisions that align with your values. ACT is based on 6 pillars, which we will get into more in depth in a moment. But the 6 pillars are contact with the present moment, values, committed action, self as context, diffusion, and acceptance. So our first pillar is contact with the present moment. There are aspects of mindfulness that go along with this pillar, and the key idea is to pay attention to our current experiences. What is happening in this moment? What is in front of me? What am I experiencing inside? This pillar asks clients to focus on what is the most useful in that moment. For example, it is more useful to use our energy and focus. Is it more useful to use our energy and focus on the anxious thoughts and feelings? Or is it more useful to acknowledge that those anxious thoughts and feelings exist and focus on what's happening around you? Values is a focus throughout many of the ACT interventions. At our core, we all have specific values. Making moves that align with those values is one of the key aspects for ACT. When working with a client to determine their values, you can offer them suggestions or look at the things they've already told you. For example, when doing this with one of my clients, we determined that his values were helpfulness, holding boundaries, and loyalty. And these values were discerned from our conversations and reoccurring themes that came up. Committed action is intertwined with values. While values helps a client to determine what is important to them, committed action asks the client if their behaviors or the moves they're making are in alignment with said values. The idea of committed action is to always be making what ACT called towards moves. That is actions that is guided by one's values that helps them move towards their goals. Self as context is one of the more complicated pillars of ACT. It refers to the two parts of the mind. One part of the mind is the cognitive side, the side of the mind that is processing the outside world and reacting automatically. The other side of the mind is the noticing part, which ACT refers to as self as context. Diffusion holds the idea that we as human beings can detach from unhelpful thoughts. The idea of diffusion in ACT refers to unhooking from those helpful thoughts, from the unhelpful thoughts. In one of the interventions we'll try today, we will look at getting hooked by and unhooking from unhelpful thoughts. There are several interventions that can help with diffusion, and oftentimes it will take several sessions before a client is ready to diffuse from a thought that they are really fused to. For example, a thought that a client might be very fused to would be something like, I am worthless. If a client is fused with this idea, it can be difficult to help them diffuse. Difficult, but not impossible. Diffusing might take a bit more preparation in this instance. Acceptance is the final pillar of ACT. In ACT Made Simple by Russ Harris, he discusses the idea of not just tolerating uncomfortable feelings, emotions, and thoughts, but accepting them. He highlights our ability to open up, make room for them, and allow them to flow freely through us. This is the ACT hexaflex, which just shows how all of these pillars working together creates psychological flexibility. So as you can see, we have all of the pillars on the outside, and all of the lines are kind of connecting to each other on the inside and showing how you can create psychological flexibility through these 6 pillars. What is the literature saying about ACT? There have been many studies over the last 30 years that have looked at how ACT applies to various age groups. For adults, the research largely indicates symptom improvements for depression and anxiety, as well as other mental health disorders. In the study listed here by Bay et al., it was also noted that for adults with mild depressive symptoms, the improvements had lasting effect. For me as a clinician, this is important because creating a lasting system that my clients can rely on is important to me. A recent meta-analysis of the efficacy of ACT for children showed that ACT was more effective than the control and comparable to CBT in decreasing anxiety, depression, and other mental and behavioral difficulties. There are currently not many studies on the efficacy with children, so further research in this area is required for definitive results. However, current studies are showing positive effects from using ACT with children. There was also a qualitative study done on the effects of ACT for teenagers in a secondary school setting, where select teachers and guidance counselors were interviewed after the program was implemented. A program called Interact was created, and interviewees noticed that adolescents were offering their engagement during the process, which spoke to the interest in the topic matter for the teens. Teachers also noted that the more that they bought in themselves, the more authentically they were able to talk to their students about these skills, and suggested that buy-in from both teens and adults in their lives may be important. In the study that was done with Latino autistic children, ACT was culturally adapted and results were associated with reduced psychological distress. It was noted that this was a small study, so further research should be conducted. In an article by Gloucester et al., it was noted that studies have been done on all continents, with most studies leading to positive results from ACT. ACT is also considered to be transdiagnostic, meaning that it can be used over many different mental health disorders. Throughout my research, I didn't find any specific disorders where it was suggested ACT should not be used. Because ACT promotes psychological flexibility, it can be effective across a vast variety of issues. So looking at ethics and culture, I previously mentioned the Glosser et al. Article where it was noted that studies have been done on all continents, and most studies led to positive results from ACT. When assessing the translations, it was determined that all versions demonstrated good content validity. So that was in relation to translating into Spanish, German, and Italian. Due to the use of metaphor in ACT, someone from a low context culture may struggle with the interventions as they are typically presented. With that said, ACT is all about creativity and adjusting interventions to meet the client where they're at. Adapting these interventions to better suit a client's needs will result in better prognosis. Implications for practice. So in Russ Harris's book, ACT Made Simple, he highlights that this modality of therapy is not linear. While a basework of values generally needs to be established, any intervention can be used through a session. He even mentions often going back to basics with creative hopelessness, which is something that we will talk about. Even if you have done more in-depth interventions before, going back to basics or using more basic metaphors like dropping the struggle, before going forward into other interventions is totally normal and completely acceptable in this modality. Meeting the client where they're at is the most important thing. Additionally, creativity is crucial. This method of therapy tends to use a lot of metaphors, but specializing those metaphors for your client specifically or highlighting what thoughts they are specifically fused with rather than using a generic approach will lead to better results. As I mentioned, determining a client's values early on can be important, especially when using something like choice point. Again, something we will talk about in a few minutes. This can be done using a quick look at your values worksheet, which I have linked for you, or just by talking with the client about what is important to them. This will help lay the groundwork for understanding what kind of life your client wants to lead. For this next section, I'm going to be using Russ Harris's ACT Made Simple to walk you through some of the interventions he highlights in there. If you're serious about using ACT in your practice regularly, I highly recommend this book as a support guide. I've included a section on resources that I have used in my practice so far later in this presentation. So the first concept we're going to look at is creative hopelessness. The purpose is to help clients recognize that they cannot control their thoughts and emotions. Really, ideally, we want to help clients to control their behavior and reactions, but not the emotions themselves. So we want to ease a client into this. One thing that you could say is, the main thing you're wanting from our work together is to get rid of these difficult thoughts of emotions, such as whatever thoughts and emotions they're feeling. If they confirm, like, yeah, that's exactly what I want, then you'll know that creative hopelessness is a good exercise to start with. Acknowledging that the thoughts and feelings that the client is going through is important. So of course, who wouldn't want to get rid of these feelings? These feelings are really painful and difficult, and they're having a huge negative impact on your life. And then, if you can ask them the 5 basic questions listed here in a genuine way, don't rush through them like a check mark on a task list, but understanding what have they tried, how has it worked, what has it cost, what's showing up, and are you open to something new? Typically, with this exercise, the acronym DOTS is helpful to think about what they have already tried. So question, what have you tried so far to avoid and get rid of these unwanted thoughts and feelings? Sometimes we have to prompt our clients' memories. That's where DOTS comes into play. So distraction, opting out, thinking strategies, substance, and other strategies. Distraction is, how do you distract yourself from these feelings? That could be watching television, listening to music, getting out of the house, keeping oneself too busy, video games, things like that would be considered distraction. Opting out would be things that maybe the person is removing themselves from. So are there important things that you're procrastinating on? Are there important tasks you're avoiding? Are there people or places you're staying away from? Are there important activities that you're putting off? These would all fall into the opting out section. Thinking strategies, talk about like, how have you tried to think your pain away? Substances and other strategies are kind of self-explanatory a little bit. It doesn't necessarily have to be drugs or alcohol. It could also be food or cigarettes, coffee, tea, things like that. So just basically something that they consume, whether it is drugs, alcohol, or other forms of substance like food, drink, etc. So then we move on to the next question, which is, how has it worked? How has it worked specifically in the long term? And we would like clients to kind of recognize that even though they have resulted to these different DOTS, different options, whether it's distraction avoidance, substances, thinking strategies, they're still having these feelings. So how has it worked, both in short term, but also in the long term? And then the next question is, what has it cost? So when you're thinking about the costs of things, for example, the cost of distraction, one of the questions asked in this book is, how much time do you spend on distracting yourself? How much money do you spend on it? Thinking about opting out, what is the cost of excessive opting out? For most people, the biggest cost is missing opportunities or missing time with loved ones. For thinking strategies, like, how much of your day are you spending caught up in these thoughts and these thinking strategies to try and avoid these feelings? And then with substances and other strategies, a lot of it can be focused on what is the cost to your health, your work, your well-being, your finances, your relationships. How have those things been affected by substance use or other strategies like that? The next question is, what's showing up? So at this point, we want to have great compassion for our clients and, empathize with them. We might say, a lot of people at this point experience some quite intense feelings like sadness, anger, or anxiety, and I'm wondering what's showing up for you right now. We also want to help the client notice what's happening for them. So notice if you are quick to beat yourself up, and acknowledge that that's our mind's way of trying to help you. It's got a strategy here. If I can beat myself up and give myself a hard enough time, that'll help me get on with my life and stop screwing up. How about we let your mind have its say, but not get sidetracked by it, and we can come back to what we're dealing with here. The last question is an important one, and it is, are you open to something new? Once we sense that a client is in contact with futility of trying hard to control their emotions, we can ask, are you open to something new? At this point, it is helpful to do a recap for the client on what they have tried, how it's worked, what it has cost. And then if they are ready to try something new, this is when we can move into an intervention. If they are not ready to try something new, then we can go back and look at the 5 basic questions and see where they are kind of getting stuck. This exercise in creative hopelessness goes nicely into drop the struggle, which is one of the more kind of basic interventions. It does require a couple of pieces of paper, one for you and one for the client. With dropping the struggle, 2 things come into play here. First, acknowledging that the struggle is the problem. Struggling against our thoughts and feelings is the problem. And the second is shattering the illusion of emotional control. This exercise will help clients to acknowledge that and to acknowledge how much energy struggling with trying to control one's emotions is. Doing the exercise with your client will help build that therapeutic relationship. It will feel more collaborative, and it will also make them feel less silly. So we're going to start with the exercise from the Russ Harris book. Okay. So imagine that out there in front of you is everything that really matters to you deep in your heart, everything that makes your life meaningful. All the people, the places, the activities you love, all your favorite foods and drinks and music and books and movies, all the things you like to do and all the people you care about and want to spend time with. But that's not all. Also over there are all the problems and challenges you need to deal with in your life today. This is a good point where you can kind of name some of the struggles you may have talked about with your client. Now, please copy me as we do this exercise. Let's imagine that this sheet of paper is all those thoughts, difficult thoughts and feelings and emotions and memories that you'd like to get rid of. Now hold it tightly at the edges like this and push it as far away from you as you possibly can. I'm not going to hold this in front of the camera, but you get the idea. This is what your culture tells you to do, to get these thoughts and feelings away from you. Friends tell you to do this, doctors, therapists, counselors, women's magazines, everyone, right? But hey, it looks like we aren't really trying very hard. Let's push harder. Push as hard as you possibly can. Straighten those elbows, dislocate those shoulders. Let's get those thoughts and feelings as far away as possible. Now notice 3 things. First, how tiring is this? We've only been going for less than a minute and it's already tiring. Imagine doing this all day, how much energy it would consume. Second, notice how distracting it is. If the person you love were right in front of you, how hard would it be to give her your full attention? If your favorite movie were playing on the screen over there, how much would you miss out on? If there's an important task in front of you right now, or a problem you need to address, or a challenge you need to tackle, how hard is it to focus on it? Third, while all your effort and energy is going into this, how hard is it to take action, to do the things that make your life work, such as whatever works for the client, whether that's going to work, taking care of their children, taking care of their pets, driving their car, cooking dinner, etc. Notice how difficult your life is when we're struggling with our thoughts and feelings like this. We're distracted, we're missing out on life, and it's hard to focus. We're exhausted, and it's so hard to do the things that make life work. Now let's see what happens when we drop the struggle with our thoughts and our feelings. Big difference, huh? How much less tiring is this? How much more energy do you have now? How much easier is it to engage with and focus on what's in front of you? If your favorite person were in front of you right now, how much more connected would you be? If there were a task you needed to do or a problem you needed to address, how much easier would it be to focus on it? Now move your arms and hands about. How much easier is it now to take action, to drive a car, to cook dinner? Notice how these things haven't disappeared. We haven't gotten rid of them. They're still here. But we've got a new way of responding to them. We're handling them differently. They're no longer holding us back or bringing us down or jerking us around. And if there's something useful we can do with them, we can use them. You see, even really painful thoughts and feelings have often useful information that can help us, even if it's just pointing us toward problems we need to address or things we need to do differently, or simply reminding us to be kinder to ourselves. And if there's nothing useful we can do with them, we just let them sit there. So with this exercise, you can customize it for your clients, make it so that you're talking about the people that they love. You can name their people in their life. You can name their work or whatever to make it feel more directed for them specifically. Like I said, this exercise was read from Harris's book, Act Made Simple, but it can be customized however you see fit for your own clients or whatever feels natural for you. Our next concept is unhooking from thoughts. So the idea is to help clients make moves that move toward their goals. Hooked is another term that is also referred to as fused. It's essentially when our cognitions dominate our behavior in a problematic way. Unhooked is the process of diffusion, which is recognizing our thoughts, feelings, and emotions do not control our behavior. Workability is what you're doing, working to give you the sort of life that you want in the long term. Is what you're doing, working to give you the sort of life you want in the long term. If yes, then we consider this workable. If no, then we consider it could be better. This is one of my favorite interventions to do with clients. With this intervention, you do need to have a bit of an idea as to what their goals are. But that's also something that you can work through with them during this intervention. So determining what kind of life the client wants to move towards, what kind of values are guiding those moves. And then when a situation arises, the client comes to a choice point. So they can either get hooked by their negative thoughts and feelings and make away moves, or they can unhook from those thoughts and feelings and make a towards move. Sometimes even having this concept of a choice point and that autonomy of you are making your choice on how you behave next can be helpful to a client. This is often best received when you create a diagram with them on what would be considered an away move and what would be considered a towards move. For example, if you have a client who wants to live a healthier life, for example, that's very vague, but for example, let's say they want to live a healthier life, more active life, let's say. A towards move might be going for a walk. Whereas a away move may be considered like sitting on the couch watching TV. And if they are often stuck in those away moves, having that idea of, is this something that I want to be doing to move towards my goals, can be helpful to unhook from those unhelpful thoughts and actions. One important thing to note with Choice Point is that right from the go, we subtly lay the groundwork for two important insights. One is that our thoughts and feelings are not the main problem. Getting hooked by them is. That creates our problems. And two, our thoughts and feelings do not have to control our behavior. The last intervention I'm going to go through with you is dropping anchor. This is partly about diffusion, acceptance, and self as context, contacting that present moment. So it incorporates a lot of the pillars. 3 things to remember is that this process is moving through ACE. Acknowledge your inner experience, come into your body, and engage with the world. Doing these exercises with the client is more impactful. It also helps them feel less silly as they do them. Prepping the client for this exercise using the metaphor of an emotional storm also helps with the imagery of dropping an anchor. So for example, when they are feeling an emotional storm in their body, asking them to imagine themselves as a boat in the storm, and what is the first thing a boat does? Drops anchor. So the storm doesn't go away, but the anchor steadies the boat until the storm has passed. Okay, I am again going to be reading through this exercise from Russ Harris's book, Act Made Simple, just so that you can see kind of the basic intervention, and then you can customize it as you wish, however would relate best to your client is ideal. Okay, so there's a lot of emotional pain showing up for you right now, and I can see how much you're struggling with it, how difficult it is for you, and I really want to help you handle it. So please follow these instructions. You don't need to say anything if you don't want to, and you can speak if you feel like it. First, take a moment to acknowledge that there are difficult thoughts and feelings showing up for you right now. And at the same time, see if you can push your feet hard into the floor. Push them down. That's it. Feel the ground beneath you. Now sit forward in your chair and straighten your back. Feel the chair beneath you. Notice your back supporting you. Now slowly press your fingers together, and as you do that, gently move your elbows and your shoulders. Feel your arms moving all the way from your fingers to your shoulder blades. Take a moment to acknowledge there's a lot of pain here that you're struggling with. You didn't ask for it, but here it is, and it's challenging, and it's difficult, and you want it to go away, but it's not going. Silently acknowledge to yourself what type of pain it is. For example, say to yourself, here's sadness, or here's anxiety, or here's a painful memory. If you know what the pain the client is experiencing is, you can specifically mention it here. Now notice that there are painful thoughts and feelings here, and there's also body around all that pain, holding it, containing it, and it's a body that you can move around and control. Straighten your back again and notice your whole body now, your hands, feet, arms, legs. Gently move them and feel them moving. Have a good stretch. Notice your muscles stretching. Press your feet down and feel the floor. Now, also look around the room, up, down, side to side, and notice 5 things you can see. Also notice 3 or 4 things you can hear. Sounds coming from me or you or the room. And also notice you and me working here together as a team. So notice there are some difficult thoughts and feelings here that you're struggling with, and at the same time, see if you can also notice your body in the chair. Gently move that body. Have a stretch. That's it. Take control of your arms and your legs. Also notice the room around you. And notice you and me here, working together as a team. Do you notice any difference now? Are you less hooked by these difficult thoughts and feelings? Are you less swept away or jerked around by them? Is it easier for you to engage with me, to be present, to focus on what I'm saying or what we are doing here? Do you have more control over your actions now, over your arms and legs and mouth? Check it out. Move your arms and legs. Have a stretch. Do you have more control over what you're doing now? So this exercise can actually be done much slower than how I've done it here, but because we only have limited time and I wanted to fit it in, that is how it is written out as an example. If you can think of other mindfulness actions that bring people into their bodies, essentially we're following the acknowledge your inner experience, come into your body, engage with the world. However it feels most comfortable to you is the most ideal situation. Okay, so this is the rest of the exercise, just so that you can see what I've done here. And in conclusion, that's it. ACT is focused on noticing and accepting thoughts and emotions while making choices that align with one's values. We went over the 6 pillars, and we acknowledged that it is a nonlinear modality of therapy that is transdiagnostic and applicable to most clients regardless of diagnoses. It has been studied widely, and while there is still lots of room for more research, largely it has been determined that it is a very effective method of therapy. Here are the useful resources that I have used in my practice so far. I will also link the worksheets with this presentation so that you can access those if you're interested. I specifically enjoyed this Happier Life Project podcast, so the episode is there for you if you're interested as well. Here are just a few questions for discussion because I know that this presentation is running a little bit long. But does ACT resonate with you? What obstacles might prevent you from using ACT with a client? Do you have any questions about the interventions we went through? Or are there any cultural elements that may result in ACT being less effective that you've recognized? And here are the references that I used for this presentation. So I hope you all enjoyed and learned something new, and I hope that this helps if you are interested in using ACT in your practice. Thank you so much for sitting through this with me. I appreciate it, and I hope you all have a great week.